Hi, I am Dr. Rahul Gupta. Today we will be showing you a video of a patient who was suffering from suprasellar meningioma. So basically, when we talk about brain tumor, meningioma, pituitary tumors and glioma come to our mind. Though metastatic tumors to the brain are the most common tumors, but most commonly we operate upon meningiomas and gliomas in our clinical practice. So here is a patient who was 80 years old and had come from Nigeria, and she was rejected by many doctors for surgery at Nigeria. She was suffering from drowsiness, vision loss and a lot of constitutional symptoms. She was quite old. Attendants were not very keen in getting her operated, but she was lucky. She had a otherwise healthy life, and now because of her symptoms the attendants were willing to get the surgery done. So they came to me in the OPD and they were just worried that if we can do a successful surgical procedure on the patient and remove the brain tumor. So this brain tumor was located behind the eyes in the suprasellar region, where it was compromising the nerves which are responsible for the vision. Also there were the area where the hormones organs are located, and they were also being pushed and compressed by the tumor. So this was a difficult area, but we had to save the life of the patient and do good for her. Her vision was going and she was nearly blind. So we discussed with the attendants. Definitely the risk was slightly high. We got her checked by the neuroanesthetist, who were also little jittery, but we all planned that in the best interest of patient we should go ahead with surgery, and we prayed to the God that everything goes well. So we can see the MRI and the CT scan of the patient, how they looked, and we subjected the patient to surgical procedure under general anesthesia. We have all the gadgets which are required for a successful surgery of similar type of tumors. Patient was taken to the operation theatre under general anesthesia. We had laid the patient on the operating table, fixed her head with a 4-pin headrest, and we gave the incision on the right side of the skull and removed the bone just above the eye, so that we can retract the lobes of the brain and enter the area and reach the tumor through the natural spaces without sacrificing any part of the brain. And we used special gadgets to do this procedure. We had a team of neurosurgeons, neuroanesthetists, neuronurses and neurotechnician along with us. And now I will show you the surgery. We raised the skin flap, reflected it, and then we removed a small part of the bone, exposed the brain by cutting the dura mater. And once we had cut the dura mater, we saw the brain, as you can see it on the screen. The frontal lobe and the temporal lobes are visible. We retracted the brain and identified the Sylvian fissure and opened it. That's a natural area located between the two lobes, so that we do not cut any part of the brain, any blood vessel of the brain. And once we reflected the brain after opening the Sylvian fissure, we could expose the tumor. The tumor was soft, suckable, firm at some places. With the help of bipolar cautery, suction, with the help of tumor forceps, CUSA, we attacked the tumor. Initially we attacked the base of the tumor. You see how we have located the optic nerve, the nerve which is responsible for the vision, and that optic nerve is separated from the tumor. And once we enter the tumor, with the help of suction, bipolar cautery, with the help of CUSA machine, with the help of sharp and blunt dissection, we were able to debulk the tumor. Once the tumor was debulked from inside, we reached the outer wall of the tumor, so that we can cut and remove the wall of the tumor as well. So gradually, over 2 to 3 hours, which we took after entering the tumor, we removed majority part of the tumor and coagulated the base of the tumor. So we had achieved almost 98 to 99% excision of the tumor. Some blood vessels which were arising from the skull base and supplying the meningioma were also coagulated. So this was a surgery which was performed with utmost patience. With the help of all the gadgets which are available, we were able to save the important arteries which were around the tumor, which are abutting the tumor, as well as the optic nerves. Both the optic nerves were exposed. Both the active optic nerves were freed from the tumor, and all compression was removed. So in this way, we were able to achieve a near total excision carefully by doing a surgery which lasted for 2 to 3 hours after reaching the tumor. You can see how majority of the tumor has been removed and hemostasis has been achieved. And after washing the area with saline, we could see that near total excision has been achieved and there is no bleeding. So such type of tumors are very common and they are located in the suprasellar region. Sometimes the tumor do not become symptomatic very soon and become very large, but I think even if there are slightest symptoms like vision problem or there is some hormonal changes, immediately MRI of the patient should be done so that we can detect the tumor at an early stage, and if we detect the tumor when it is small, we can subject the patient to surgical procedure which is very safe and curative. However, for large tumors, there are chances that there might be injury to some blood vessel, nerves or brain and may lead to some deficits. We were lucky in this patient that total excision was done and patient said that slight improvement in the vision is noted in the immediate post-op period. Patient was admitted for 5 days, initially 2 days in the ICU, then in the ward, and after stitch removal which was done on 12th day, patient was sent back to Nigeria. She was happy and we got the message from there after 3 months that patient is doing well. So we are thankful to God as well as the patient attendant and our team who all were dedicated towards securing and operating upon this patient, and we were lucky and the results are with us. So again, I will request people that even with slightest of symptoms related to brain, cranial nerves or limb paralysis, seizure or headache, they should consult a neurosurgical team where a CT scan, MRI can be done to detect any tumor if it is there at an early stage when it is small. Sometimes these tumors can be subjected to radiosurgery, either gamma knife, cyber knife or stereotactic radiosurgery, which is another option. But if there is a threat to the vision, there are neurological deficits, then surgery is the best option. It can give quick results and there might be improvement in the neurological deficits. So I hope you liked the video. Thank you very much for your patient hearing.